Yes, welcome to St. Thomas's Hospital. Um, yes, I'm in St. Thomas Hospital at the moment. Just taking you through the visit to the hospital. Enjoyed it. Hello, this is Ola Rachel live from St. Thomas's Hospital. Just want to talk about coming to the hospital. If you want to pay a visit to the hospital, you got an appointment in the hospital. A lot of people have this fear of what's going to happen. You don't want to be tied in the hospital and all this, and that fear, that uncertainty and stuff like that, especially in this time when there's a pandemic, the fear of, you don't want to catch them. You don't want them to find out that you need to at least stay in the hospital. That fear. The thing is, the first thing you need to bear in mind is that the doctors and nurses are there to look after you. Look at your condition, because the thing is with different conditions, if you don't really come out to actually get tested for whatsoever symptoms you're feeling, it might become really complicated before you now respond to whatsoever symptoms you have, and then at that time it might be too late for you to get the right treatment. So I encourage you to actually remove the fears. Remove the fears. I mean, when you get to the hospital, let the nurses know what your fears are. Let the consultant know what your fears are. And by that, they will be able to work with you to give you that assurance. And if you're not really happy about whoever is seeing you, they're more than happy to get you someone else, another practitioner that will actually attend to you, so that you'll be able to feel comfortable to get the right treatment that you want. And if you're not happy about the treatment, I mean, you're not in prison. Even people in prison, they have their freedom. To be able to express themselves. There's what we call freedom of speech. How much more? You are the patient. They're there to help you. So there's a need for you to be open. Be expressive. If you're not sure about a treatment that they want to give you, ask if there's any alternative treatment because of your fears or whatsoever. Don't just allow consultant. Don't just allow consultant just start doing giving you treatment without you being sure about what needs to be treated and alternative treatment options for that condition that is being investigated, because 9 out of 10 times they're still finding out what they need to treat. So unless they are really sure what they have to treat. So, and there's that elimination process that they do. They first look at, the worst case scenario of that symptoms, because many symptoms have, many conditions have different lot of similar symptoms here. Many conditions have a lot of similar symptoms. So what they do is to first eliminate the worst case scenario that has that symptoms before they now go down to the easier or milder or moderate to milder some conditions or complications. So, but in the whole, they're there to work with you. But you have to be open, you have to be confident. If you're the person, this kind of person that find you've got to actually express yourself, get somebody to come with you. You can even let them know that you want someone to come with you, because even though you're an adult and they expect you to know what's wrong with you and be able to express yourself, but if you find it difficult to express yourself, let them know that you want someone to come with you. There's no shame in having somebody that can explain things better to explain for you, but let them know that I want this person to actually explain to God. I find it difficult to express myself. So by that, they'll be able to work with you. It's not just people that cannot speak English that needs interpreter. Someone that doesn't have that confidence to express themselves can also come forward with somebody that will help them to explain what their condition is. I mean, there might be someone that actually knows you a lot more and know how to actually word those conditions or those symptoms that you are feeling. It might be your child, it might be your spouse, it might be your your close friend or what have you that can actually help you to express yourself so that you can get the right treatment, so that they can actually get the right picture of what is wrong with you, what are the symptoms, and know how best to actually treat you. And you can ask for, alternative procedures to the complicated procedure that the MAFO suggests. Because some of the procedure that they carrying out might even still be investigation, which might have its own complication. So you don't want to fall victim of another complication for investigation, which will actually put you in a different ballgame. Take for example, there's this thing that they call, if people that are having like heart related problems, that there are still this thing they call EP study. An EP study is a procedure where they put a tube down your groin, straight through the veins into your heart to check what veins or arteries is causing the problem or whatever. Maybe you're having a regular heartbeat or you're having issues around your heart. They investigate. Then they use that to investigate before they know what nerves or veins or what have you to treat. But then that can get you struck. You can get stroke, you can get, soreness in the heart or many other complications. But what if it's just neuromuscular issues? So it's not really from your own heart. And sometimes maybe you might want to try with some medication first. If you ask for alternative treatment, and if that doesn't really help, then you now go down to that brain table. So that's it. So please be expressive. Let them know what your fears are. Let them know what your aspirations are, and they're there to actually help you. And good luck in your hospital visit. Please, if you have any question concerning or fears concerning going to hospital or fears of going to see a consultant, or you have any symptoms that you cannot really explain or express, leave your comment down below. I'll be more than happy to assist you. Thank you very much, and have a wonderful day. Cheers.